Hello, I'm Kim Meredith, and I'm CEO of the San Francisco General Hospital Foundation. And on behalf of the foundation and the Zuckerberg San Francisco General Hospital, welcome. I'm truly delighted to host you today for this discussion with Dr. Susan Ehrlich. And the foundation's mission is to provide essential funding for the Zuckerberg San Francisco General Hospital for health equity, access, and care for all, built on the pillars of innovation and new models of care. We do our work because of all of the support that you give us. So we are incredibly grateful for all of the human capital, intellectual capital, and financial capital that you share with us on a consistent basis. So thank you for being here today. It absolutely provides the much needed funding for all that is going on at the Zuckerberg San Francisco General Hospital during good times, during bad times, such as this pandemic, and all the time. So thank you. Today's format will be that we will start with a 15-minute interview of Susan, Dr. Susan Ehrlich, and then we'll go into a question and answer time with all of you, the participants. And some of you have actually sent in questions in advance. And so we have those, but I would ask if you actually have questions that you want to submit to put them into the Q&A chat box at the bottom of your Zoom screen, and we will group them and themes, and then hopefully bring as many of the questions as possible that you are asking to Dr. Ehrlich. So with that, let me welcome Dr. Susan Ehrlich, who is the Chief Executive Officer of the Zuckerberg San Francisco General Hospital. She is the Professor of Medicine, also at the University of California, San Francisco. So with that, let's start in. Welcome, Susan.
Good morning, Kim. Good morning, everybody. It's a delight to be here with everybody today, and I'm so grateful that you chose to tune in and hear more about what's happening here at Zuckerberg San Francisco General Hospital. And thank you for your support.
Thank you, Susan. So Zuckerberg San Francisco General Hospital has really been at the hub of what's going on in San Francisco during this COVID pandemic. And in fact, you've treated 30% of the COVID cases. So are we going to run out of hospital beds? We're, in the middle of this new resurgence and wave of cases. What is the size and scope of the current situation in San Francisco related to number of cases, deaths, ICU capacity, and should we be worried? And then who has been most affected by the pandemic?
Okay, well, there's a lot to that question. First of all, I want to say that this has been, this month of January really has been the most difficult time we've been in the pandemic. Each part of the pandemic has posed different kinds of challenges, but we are definitely seeing more COVID cases, more hospitalizations, now than during any other time of the pandemic. And we know that's true mainly because of the holiday surges. We had Thanksgiving, Christmas, and New Year's, all of which contributed to an additional surge in cases, sort of building on one another and leading us to the time that we are right now. So today, the city's most up-to-date data, which is a couple of days old, puts us at 29,490 cases and 275 deaths. It's an enormous number, and it's really just terrible that we have this pandemic going on in the city right now. I will say that even though this is the most challenging time of the pandemic, it's also by far the most hopeful. I know we're going to be talking more about vaccinations, but also what's happening right now is that we've gotten far enough past those 3 holidays that we're actually starting to see a downturn in cases and a downturn in hospitalizations, which is really great news, and especially a relief for us here at Zuckerberg San Francisco General, because At one point, a week or so ago, we had more COVID positive patients in the hospital than we had at any other time, almost 70 of them, which is really pushing the limits for what we can accommodate here, in addition to all the other things that we deal with. I want to just say one other thing about San Francisco. So even though we have been so devastatingly impacted here, we're actually doing so much better than so many other places. And there's a lot of reasons for that. I think chief among them is that we as a city, not just a hospital, but a city really have chosen to follow data, science, and facts in our decisions about how to manage the pandemic here. And the best way to characterize that is by looking at cases per thousand and deaths per 100,000. And when you compare our rates of cases and especially deaths, looking and comparing ourselves to other major metropolitan areas, we are lower than almost all of them. We're second lowest in cases only to Seattle, and we are the lowest in death rates. So that's that's really good news, and it's because of the way that we've managed the pandemic so far.
So, well, we've had better numbers than so many cities, as you just indicated, and much lower death rates. I mean, my goodness, 275 compared to some of the numbers we've heard in other cities is really quite extraordinary. So that is helpful to know. But there are also certain communities that have really been affected more than others. Can you speak a little bit about that? You know, when I think about in particular the generals in the Mission District, and 50% of the population in San Francisco is from the Latinx Hispanic community, yet the numbers in terms of COVID cases, in terms of my understanding, is substantially higher than the rest of the population. Can you address that and, you know, your role in terms of access and health equity and the reason we have this incredible public hospital to serve the community?
Absolutely, and I feel so privileged to work here and to ensure that that the city is taking care of the populations and the people who are most affected by this pandemic. And here in San Francisco, that has clearly been the Latinx community. So in San Francisco overall, the Latinx population is about 15%. Today, the cases are about 43% Latinx. At the early time of the pandemic, this was just above 50%. So as the pandemic has proceeded, we've seen the disease spread more among other communities, but clearly still, you know, 43% of the cases versus 15% of the population. It's just a terrible scourge. And even though the deaths are distributed differently, we still see especially a disproportionate number of deaths among the African-American community here. And it's clear throughout the United States that the pandemic has really primarily affected communities of color. And this is just kind of shining a laser beam into the healthcare disparities we know we have as a country overall. And I think one of the hopeful things coming out of this is that the pandemic has made those disparities so incredibly clear that I think as a nation, especially with the new administration, we're going to be poised to really hopefully address those disparities going beyond the pandemic.
Thank you. That's good news. And I think the fact that we actually have to a certain extent, really exposed a problem that's been exacerbated. So let's talk a little bit about hope as we think about the future. We have a new tool, the vaccine. And your hospital, ZSFG, was the first to receive the vaccine in Northern California in San Francisco on December 15th. So tell us a little bit about what happened, how that impacted your work, and how's that going?
Oh, wow. That was the best day. December 14th, we started vaccinating our healthcare workers here. The first person at ZSFG to receive the vaccine was Dr. Antonio Gomez. He is the medical director of critical care here, and he was followed by a number of other health workers with a lot of pomp and circumstance. The mayor was here, the director of health was here. It was just the most exciting day, and that excitement really continues. So at this point, we have vaccinated virtually all of our healthcare workers with at least one dose. We've had an incredible uptake of the vaccine among our staff. About 95% of the staff who are offered the vaccine are taking it, which is really amazing news. That is not true in other places. That uptake is about, it can be as low as 50%. And so I think what that really speaks to is, trust and our ability to convey information to people in the way that they need it in order to feel good about receiving the vaccine. So and we've started to vaccinate our patients. A week ago, Thursday, I was able to offer vaccination appointments to some of my patients. And it was as if they had just won the $1 million lottery. It was really great to be able to offer those vaccinations, and vaccinations continue here. We are vaccinating now. We're vaccinating staff in one location, staff and patients in another, and patients in yet another. So here on campus, we're vaccinating patients 65 and older, and people who are in-home supportive services workers. So basically people who care for disabled people in their homes, truly bona fide healthcare workers. And that's been going really well. Now, as you know, and as you've been reading, vaccination rollout in this country is bumpy. And I think there are really two key reasons for that. One is that there's just not good data, good transparent data about how much vaccine is coming in, and even more so how much vaccine is being administered. In California, in particular, California is listed as a state that is administering a very low percentage of the vaccine it's been given. But I actually think that the reason for that is because the data is so poor. I think that there's more vaccine that's been administered than we know. And a perfect example of that is here in San Francisco. I don't know, we have a great public website that has all kinds of information about COVID overall, cases, case location, all the statistics I was talking about having to do with, age, gender, race of people affected by COVID. But recently we have a vaccination site. And what that vaccination site shows as of this morning, that we have about 31,000 vaccines administered in the city so far, vaccinations. So the problem with that, though, is that it doesn't include, for reasons that are very technical, data from Kaiser and Sutter. So we know, even in San Francisco, that even though the data show 31,000 people being vaccinated, or about 3.5% of the city, we know that number is higher, just because we know Kaiser and Sutter are giving vaccinations. So, and then of the data that's there in the website, and we know from our own EPIC data, about almost 20,000 individuals have been administered vaccine from the Department of Public Health. So here on campus, that is patients, that is staff working in the San Francisco Health Network largely. That includes Laguna Honda, and it includes vaccinations given at the command center at Moscone. And the way we're doing this in San Francisco, I think, is a good model for other places. It's truly a public-private partnership. So it's not just, so the city is working with the other large healthcare delivery systems in the city to administer vaccine. And that's getting started slowly but meaningfully. So for example, today, there's a mass vaccination site opening at City College. That's one of at least 3 envisioned in the city. That is a partnership between the city, UCSF, Dignity, and One Medical. And it's going to be focused on vaccinating people over the age of 75. And I know you're going to ask me, well, how do I get my vaccine there? And I don't know the answer to that, but that information will be forthcoming. I think today is a soft launch to really work out the workflows there. It's a drive-through site. So lots happening, very exciting, very hopeful.
That's great. Our new president has made a declaration that he wants to get 100 million vaccinations into arms, if you will, in his first 100 days. So based on what you've just shared and what you were hearing and learning, any additional insights that you would share with this group, or that you would want President Biden and Vice President Harris to hear from your team?
Yeah, well, I know the state is advocating for these two things that I'm going to mention because we've had been in discussions with them. And that is two things. One is we really need better data. We really need to know, how much vaccine has been given, how it's been administered, and that's possible. It just really needs to be worked on. The second thing, and possibly more important, is that we need to have better understanding about how the vaccine is going to be delivered to us. Literally, the state knows about 48 hours in advance about how much vaccine it's going to be given. And those amounts are not well understood. They vary quite a bit. And so that just shifts down to the local level. We can vaccinate more people if we know how much vaccine we're going to be given, at least 28 days in advance, which is the full cycle for the Moderna 2-shot vaccination.
Okay, that's thank you for that. And for those of you on the call today, if you'd like to hear more about what some of those plans may look like, our Hearts in San Francisco, our annual event, will be on February 11th from 6 to 7 p.m. It's digital, and it will be open to all. And Dr. Susan Ehrlich, we will have her in conversation with Dr. Robert Rodriguez, who is part of the Biden-Harris COVID task force team. So it will be live so that we can have the most up-to-date current information, so that when somebody says, where do I get my shot? Maybe we'll actually know a little bit more, or there'll be a broader plan between now and February 11th. So I invite you all to think about that, and please feel that you can join us. The event is open to all, free to the entire community. So on that note, I'm going to get ready to start answering some questions here from the audience. But before I do that, I'll ask you one more question. Between March and July this year, we raised almost $5 million for our COVID-19 fund at the foundation to support your work at the General Hospital. And we've distributed those funds for a combination of things, from PPE and testing to telehealth and equity work. What are your current needs? What is the surge showing you? And what does that mean also in terms of your ongoing needs and just sort of the look ahead?
Yes, well, first of all, I just want to thank everybody for supporting us in the most robust and generous way that you did. I can't tell you how meaningful those funds were. And one of the things about how they were useful is that they were flexible. And we were really able to pivot, on a daily basis to provide funds to the places that we needed them. And so continued support of that type is going to be really important for us. And I would say that, right now, knowing what we know, the support would fall into a number of different efforts. So first of all, vaccination, just making sure that we have the resources we need to administer the vaccine. It's important to remember that at least heretofore, we're receiving the vaccine, but the resources and the wherewithal to actually administer it is coming out of local funds. So that's clearly going to be, one of our most important goals. Supporting our patients in the community is another really important thing. Making sure that our patients have enough food to eat, enough, enough resources to shelter in place. It's that's still going to be a big deal for folks, and getting information out to them about the vaccine and how we can be helpful to them. Telehealth will continue to be an important priority for us. All the signs are that we will be able to continue our efforts here. The $2 million so far that the foundation has devoted to this is really important. That will continue to be a need. And then I think really supporting our staff. It's hard to describe what this last year has been like for our staff. We are the most devoted team on the planet. People are so committed to providing excellent, compassionate care to our very unique and special population here. And after a year, that takes a toll. So there are all kinds of ways to support our staff, and I think that's another really important area.
Well, thank you. And the everyday work that you do, supporting the community with chronic illness, new immigrant community, low income community. I mean, really, it's just extraordinary. And for those of you who haven't spent a lot of time at the General, I mean, these specialty clinics, the clinics for mothers and children, maternal health, prenatal, just everything that you do, Susan, is really so meaningful, and it just changes people's lives. So thank you for that. We are absolutely honored to support your work. So thank you.
We have an amazing team here. Thank you for acknowledging that.
You do. I have some questions from the audience, and I'm going to start with the first one. Some of these have come in advance, and some are in the Q&A here if you want to add any of yours. The first question is, are there categories of people who should not be taking the vaccine? For example, somebody who is in the middle of cancer treatment or pregnant women. So can you talk a little bit about that based on what you're hearing and what you know so far?
Yeah, the short answer to that question is no. There are no categories of people who shouldn't be receiving the vaccine. There are groups of patients who, if you have had experienced anaphylaxis to any particular thing, a vaccine or a drug, we're going to watch you longer. In general, I don't know how many of you have been vaccinated so far, but when you receive the vaccine, you will be watched for 15 minutes to make sure that everything is okay, because most adverse reactions happen within that period of time. If you have a penicillin allergy, for example, or an allergy to anything else, we're going to watch you for 30 minutes. And I will say, of the thousands of doses we've given here, it's been extremely well tolerated. We've seen really, no big severe reactions. The common reactions to the vaccine, some of which I experienced myself, are a sore arm, fatigue, headache. Some people feel a little feverish, but these are by and large, mildish, and they go away after about 48 hours or so.
Great. Thank you for that. The next question that I have is, given that the vaccines have some failure rate, albeit small, why would a person not get an antibody test, say after 2 weeks, after the second shot, to see if in fact they know that the shot worked, the vaccination worked?
Well, so here's a fascinating fact that I didn't know actually until recently, and that is that the protein that the antibody tests for is likely not going to pick up the fact that you've been vaccinated. So it's possible, if you look on the CDC website, they will say it's possible that your antibody test may be positive after being vaccinated, especially after a few weeks, but we don't expect it to be because it's just not picking up the same protein. And I'm a good example of that. I was vaccinated, my first vaccine on the 28th of December. And because I'm enrolled in a study of health workers, I had an antibody test on January 12th, and it was negative. So, the study principal investigators have let us all know that we don't expect your antibody test to be positive. So, I think we have to rely on the clinical trials of the vaccine to tell us about effectiveness. Of course, that was done in tens of thousands of people, and the two vaccines, Pfizer and Moderna, were shown to be about 95% effective. So I think that's the information we need to rely on. And still, my last point about this, even after we've been vaccinated, it does not mean that we don't wear masks, social distance, and do all the things we did before we were vaccinated. That time when we were able to put all of our masks in a large burning pyre, that's many, many months away.
Great, thank you for that. That was a really interesting question. Another question that has come my way is, what do you think, and this is probably about our final question, what do you believe will be the biggest challenge in bending the curve? And any additional insights? Maybe
yeah, well, it's the same things. Well, really, what's going to cause us to bend the curve is doing all the things that we've done before: masking, distancing, staying within our family units for the most part. That's going to continue to be the most important factor in bending the curve especially for the next few months. The thing that will add to that is vaccinating as many people as we can as quickly as possible, because what bends the curve is fewer cases and more immunity. So right now, about 16% of the San Francisco population has either had the illness or has been vaccinated. And we're already in the projections, the experts who are doing all the modeling, we're probably already starting to see a slight downturn or a bending of that curve just because of the, at least 3.5% of the population that's been vaccinated so far. So those two things are really what they're going to keep us bending that curve downward.
Well, thank you. That is really great news. A final question for you. What gives you optimism for 2021?
Well, I hope that everybody has seen the optimism in my voice and my presentation. I'm, generally a pretty optimistic person, but right now I have even more optimism than usual. And I think principally that's because controlling the pandemic is in sight. We still have a lot of hard work to do in order to finally get it under control, but it's in sight. We can see that light at the end of the tunnel. And I think locally, what I've seen over this past year, it has been almost exactly a year to the day that Mayor Breed declared a local state of emergency. That was on January 25th of 2020. And what we've really demonstrated here locally is that working together, public, private, all of the community, we can really manage this pandemic better than most other places. And then finally, this new administration gives me a lot of hope because they, like we, will be approaching the pandemic and other things related to healthcare with science, data, and facts, and with a real focus on health equity and improving health equity. So all of those things really give me a lot of hope and passion for this moment.
Wonderful. Thank you, Susan, for that. And thank you all for joining us this morning for this briefing and update from Dr. Susan Ehrlich, CEO of the Zuckerberg San Francisco General Hospital. And I look forward to seeing all of you on February 11th from 6 to 7 p.m. at our Hearts in San Francisco event, where you'll get an even next iteration of this update from Susan and Dr. Robert Rodriguez from the Biden-Harris COVID Task Force. So please go to our website, sfghf.org or Hearts in San Francisco, and register or set up a virtual table. Look forward to seeing you all. Again, thank you for joining us.
Thank you so much for your support. We could not do it without you. Thank you.
Thank you.